Hi guys, we're just going to have a chat today about all things Academy. I'm just waiting for Colin to come in. He's sat there and his pensive look on his face, obviously being very busy in the clinic. Oh, hello. How are we doing? Colin, you're on mute.
Oh, yeah, I'm fine, thanks. I've just had to dub my... I was quite busy.
That's really horrible.
So I went to Brazil and I managed to clone myself.
So we've done Dolly the sheep, now we've done Colin the dentist.
Yeah, so if I don't, I can go in lots of different directions. I can disappear into myself if necessary, like that. And so I think that's going to work best. So one of me is going to work downstairs in the clinic most of the time, and the other one's going to work in the academy. I hope that works out.
Yeah, that's great. I mean, two of you is almost the same size as one of me, so that's good. We're finally on parity.
I think we're going to have a quick chat about training in restorative implant dentistry. I think basic restorative implant dentistry is what we're talking about.
Yeah.
So finding a pathway into implant dentistry from general practice, really.
Yeah.
Which is a classic route into implant dentistry, isn't it? A lot of people have taken that path.
It certainly used to be. I don't know whether it still is.
I always go back to I think we did it from the practice back in like 2000, maybe. And some of the guys that came on that course still restore. And one of the things that the implant companies were very keen on at that stage was for a practice that was doing implants to get a cohort of GDPs that didn't want to do surgery to refer in. I think that part of what happened to dilute that process was that lots of people got peripatetic guys into the practice to do the implants, right? And that kind of diluted the model. But I think it's now a model which is returning back again. I think what we ended up with in that situation was a lot of practices not doing very much. You know that from Straumann's 15 implants placed a year, which is a big, massive ask to have enough stuff to place a little bit of implants in your practice and have staff that are trained in kit and all that available. And then people are starting to realise again that you have to place the implants if you can work collaboratively with good guy who places, who sends the patients back to you for restoring cases at the level at which you're capable. Yeah.
I think the other thing that's becoming very apparent is that how many people are having implants and therefore are going to walk through the doors of anyone's surgery. Yeah. And to be able to not necessarily do anything with it, but to identify what's been done, how to manage it, how to maintain it, and everything else that surrounds restorative dentistry.
The classic way for doing this was a one-day course, first of all. Wasn't it? 1 day, come in, find out what some of the bits and bobs are, and away you go. Much in the same way that the way to start implants was a 2-day course. Yeah. Friday, Saturday, or Saturday, Sunday. And then some of the restorative courses were 2 days. And you can, in a 2-day format, get people to a reasonable understanding of this. But our stuff, the development of our stuff, which kind of looks, doesn't it, the digital stuff at the Academy looks like it's a reaction to the pandemic. And of course,
well, yeah, it was always on our radar to do it. All the pandemic did was give us the time to actually do it. It didn't change the strategy.
But we know educationally, don't we, that a 2-day hit or a 1-day hit is not anything like as good as a broader educational experience.
Yeah.
So we now know in educational sort of science that these gaps that exist between exposures to education help you cement what you're learning. And so to do it over a longer period of time is probably better. But also now to do it at a way that suits practitioners that are really busy, to be able to do it to a degree in their own time is what we're trying to facilitate with the new design of these accessible digital courses.
Yeah, and it's not to replace that hands-on training by any stretch of the imagination. It's just to get everyone going, because I think there seems to be barriers to people going on restorative courses at the minute, and that's not just us, but if you speak to the suppliers and Straumann and so on, I don't know what those barriers are entirely, but obviously time is an issue. I think it's an issue for everybody. Yeah. I can't help but think that indemnity is an issue that rears its ugly head every now and then, that people get scared of making that leap into restorative. You know, some indemnifiers charge more than others to actually take that jump. Some don't charge at all. So it'll be interesting to see how that pans out over the coming years, because I think everybody needs to be trained in some of it.
Yeah, it's part of that, separating it into straightforward, advanced, and complex, and making sure you don't jump into a level of industry that you're not capable of doing yet. That doesn't mean you won't be capable of doing it, but you see it, and we see it where guys, with the case they bring in at the early start of their career, is just horrendously difficult. You go, that's not for you, because you'll just fall down. So trying to teach and give people the opportunity to learn implant dentistry to replace molars and premolars. And it is straightforward when you grab it and you've got some support. It is a wonderful thing to be able to do. So someone else takes the surgery side off you, whoever that someone else is, and then delivers the patient back to you, and you have a relationship between surgeon and restorative dentist. And just because you didn't do the surgery in your practice or didn't get them in doesn't mean you've lost out on anything.
No.
Probably a lot of the time you've saved yourself a whole load of costs and a whole load of hassle from just working with somebody who you trust. And so what developed on in discussion with Straumann after, that whole 15 implants a year thing, which is terrible for the implant company. It's really terrible for implant dentistry if you're not placing more than 15 a year. It's this idea of, if there's 4 of you in a locality that are placing 15 a year, why don't you pick the best guy and send them to him?
Yeah.
And restore, and then move on and do some other aspect of dentistry with which you're going to do more of that you enjoy more. So making sure people have an access in, and the digital course, the digital restorative course, I hope is that accessible way to do that in your own time over a period of time, a defined period of time, say 4 to 6 weeks, with all the kit available for you to be able to work at your own pace in a non-intimidating way, isn't it? And come out of it much better than you would come out of something if it was a one-day course.
Yeah, I think the opportunity to sort of work over a period of 6 weeks with peers, I think gives you that extra communication about what you're doing. And that's going to cement the learning that we're going to give you. The way that the course is going to be run is on our online platform. So on the online platform, you're going to have all the resources available, lectures, downloads, and everything, all the sort of didactic learning material. We're then going to have a communication channel on Slack, which is going to be all of the delegates on the course, and each module throughout the course will have its own tutor who will work on Slack, answering questions and essentially facilitating that module. Within the modules, there'll be projects such as, for example, you'll be asked to take an impression as part of the restorative course, and we'll ask you to post photos of the projects, and you'll get feedback from peers as well as the tutors. So on completion of each project, you will then be allocated CPD credits for those projects. So, I think the key thing, it's going to be a blend of didactic learning, practical learning, and peer review as well, which I think is a really good way to learn, as we've seen from the previous digital courses that we've run.
Yeah, I think that whole Slack platform thing that we've got done in all the courses, and they've been able to ask each other questions about it and post your stuff and comment on each other. That's golden. It's amazing. And we know we use Slack right through the business, don't we? Right through the business in terms of the clinic side, and right through the business in terms of the academy side. It's just such a powerful tool. And it's based, this format, based on the business course format, the digital business course, and the way that format works over that 6-week period is just an accessible way to nail some really high quality CPD, A, without traveling, B, without staying in a hotel. At a time that suits you. You can store it up for the weekends, you can do it in the evenings, you can do it when you have some time off during the week, and that's got to work in terms of an access course. When you move on to other things, of course, you need to be face to face for certain things, or you want to be. That's an access course for some of this type of stuff to catapult you into the early stages of implant dentistry. It's got to be the more successful way of doing that, isn't it? So yeah, it's fascinating to see where it goes, isn't it? Fascinating to see how people take it on board and move on and develop practice.
Yeah, I mean, it's Straumann are excited, which is great. They've been wanting to trial this model for quite a while, and actually they've been sending out where a territory manager would go in and see a dentist to show them a new implant or something like that. They've been sending stuff out, and I think it's a really good way to not take up sort of really valuable daily clinical time. So it's giving you that flexibility to have everything at your disposal, work at your own pace. So yeah, I'm looking forward to see how it pans out.
When
12th of April?
It starts in April, doesn't it? So it starts in April. and then hopefully we'll run it regularly for the guys who want to come. So hope if you're watching this and you're interested in it, or you know someone who might be interested in starting out in this type of thing, it's quite accessible and quite inexpensive way to get moving and started on implant dentistry.